welcome to the Forgotten Trimester YouTube channel where we chat about all things postpartum. I am Dr. Megan Gray. I am a board certified OBGYN and mom of two littles. On this episode, you are going to learn all about breastfeeding basics. We are going to dive right into identifying early hunger cues in your baby. All right, so it is so important to identify early hunger cues in your newborn. Reason being is that this is a very high stress environment, right? We are exhausted. We are recovering from being pregnant for 9 to 10 months. We are recovering from a delivery, whether it's vaginally or via C-section. And we are learning all these new things about this tiny little human, right? So it is so important that the breastfeeding journey starts out as productive as possible. Breastfeeding can be very challenging. It can be frustrating. It can be time consuming, and that's all very normal. That's all feelings and emotions that no one tells you about breastfeeding. That although it is very natural, it is a learned behavior, and it takes time. It takes patience. It takes grace. It takes education. And so let's start with education number one. Let's talk about early signals for hunger. So it's ideal that we put baby to the breast and start feeding baby when baby is just starting to get hungry. We don't want to wait until baby is hangry, because think about it. What do you do when you are hangry? You get fussy, you eat anything in sight, you don't care what it is, you get angry when you can't open the packaging very quickly, you get angry when you can't find something very quickly. Well, guess what? Baby does the same thing. So when baby's hangry and just exhausted and just needing to eat, they are going to cry, they're going to move their heads back and forth, they're going to get super frustrated if they can't latch on immediately, they're going to get even more frustrated if the milk letdown takes more than 0.2 seconds. So let's talk about early hunger cues so we can avoid all of that. So some of the early signs of your baby being hungry: lip smacking, so they can, or they can stick their tongue out, or lick their lips. All of those are early hunger cues. So this is them, hey, I think I'm starting to get hungry. Other signs: clenched fists. When babies are hungry, they tend to be more contracted. Their muscles tend to be a little bit more contracted, so they'll clench their fists. They'll bring their hands, or attempt to bring their hands to their mouth. They don't have the capability quite yet to do that like we do. So they will attempt to put their hands in their mouth or their fingers in their mouth. So if you notice they're starting to suck on their arm, their hand, anything that they can get close to their mouth, that is an early sign of hunger cue. Or starting to move their head. If they're laying down there, they're kind of moving their head back and forth, looking around. They can be, a lot of times they'll be doing the whole lip smacking at the same time. So those are all early hunger cues for the newborn. And it's very important to identify those in your baby, and every baby is different. Not all babies are going to give you the same cues. So kind of in the first couple days to a week, start noticing what your baby's doing. And if you notice any of those signs, pick that baby up and latch baby to the breast. Don't wait until the baby starts crying, because crying is a very late cue for hunger. And like we just said, at that point, baby is going to get frustrated very easily, which then if you're having a hard time latching the baby and the baby's frustrated and screaming, you're going to get frustrated and give up. So we don't want you to give up. We want this to be a great experience. So a great experience is when you have all the knowledge you can have. And then certainly if you're having trouble latching baby, even when you identify those early cues, get a lactation consultant to help you. They are amazing people. They are very well educated on all things breastfeeding. They can go over normal and abnormal with you. They're amazing at finding the best positions to help baby latch. Most hospitals, especially the larger ones, will have a lactation consultant on staff. If they don't, then ask for a referral, or ask if there is anybody that the nursing staff or the physicians are aware of that is available for lactation consulting. So I hope this helps. I hope this gives you a little bit of relief and stops the stressful breastfeeding and waiting too late to put baby on the breast. If you like this information, please, please, please give me a thumbs up, follow me, tell your friends. I love educating people. So join me again next time for another episode on Forgotten Trimester. See you later, guys. Bye-bye.